What is a breast lift surgery?
A breast lift surgery is a procedure to correct breast sag. Sagging means the shape of the breast starts changing with either weight loss, with age, or with breastfeeding. The breasts start drooping down, and there is slight loss of volume and they appear deflated. So, breast lift surgery corrects this. It gives back the youthful, rounded, and perky appearance of the breasts.
What is the difference between a breast reduction and a breast lift?
In a breast reduction surgery, the excess breast tissue is removed. The volume and the size and shape of the breasts all are changed. However, in a breast lift surgery, there is no removal of breast tissue. Only the extra skin on the breast is removed, and the main focus is on reshaping the breast and achieving a more rounded and a youthful contour. That is the main difference between a reduction and a lift.
Who is the right candidate for a breast lift surgery?
A woman who has breast sag, that is drooping of the breast, that would be because of weight loss or following pregnancy or lactation, and who wishes to have a more rounded, youthful and perky contour to a breast without losing any breast volume or size, is the right candidate for breast lift surgery.
Are there any tests to be done before the surgery?
Yes, before undergoing a breast lift surgery, we go for anesthesia checkup and your medical fitness. So your routine blood work, that is your hemoglobin, your blood counts, your kidney and liver functions, and your clotting profile, as well as ECG to check for your heart status. All these tests are done.
Which anesthesia is used for the surgery and how much time does the surgery take?
For a breast lift surgery, we prefer full anesthesia or general anesthesia. In patients who are not fit for full anesthesia or do not want full anesthesia, we can go for local anesthesia plus various blocks as well as some sedation. The time required for surgery would be around 2 to 3 hours for both sides combined.
What is the duration of hospitalization and how much is the recovery time?
Breast lift surgery can be done as a daycare procedure, as in you can come in the morning, get operated and go home by evening. In case you're not comfortable, you can also stay the night and go home the next day. The recovery is very fast and you can resume all routine activities the next day itself. However, I would advise to take a few days off, 1 or 2 days off from work before joining back. Vigorous activities and strenuous exercises are to be avoided for a few weeks following your breast lift surgery.
When can we see the results of breast lift surgery and what are the precautions that need to be taken after surgery?
The results of breast lift surgery are immediate. Immediately after the surgery, you will see the change in the shape and the appearance of the breasts. They'll appear more youthful and more rounded. However, immediately after the surgery, the breasts are slightly high riding. They settle into their optimum position a month or two after the surgery. And the precautions after surgery are mainly to use either a sports bra or a pressure garment which is properly fitting to give some support to your breasts. And the second thing is to avoid heavy activities, chest exercises or strenuous workouts for a few weeks following your procedure.
Will there be scars after a breast lift surgery and what is done for the same?
A breast lift surgery does come with scars. The type of scar depends upon the amount of lift that we need and also the technique that we use. So once the scars settle, we can use various ointments and silicone strips to make the scars more faint. Also, in some cases, laser treatment is a good option to make the scars fade away.
How risky is a breast lift surgery?
The breast lift surgery is a very safe procedure. Before surgery, we go for your entire medical workup as well as your fitness. So, if you're medically fit, you should not have any problems.